You know what shocks me most as a doctor? It's not how many older men have questions about their sexual health, that it's how many of them are too ashamed to ask. I've met war veterans, retired CEOs, lifelong husbands, men who faced life's greatest challenges. But when it comes to one simple question, they whisper it like it's a sin. Doctor, is it still okay for me to masturbate at my age? Let me tell you something that might surprise you. What you've been told about aging, desire, and what's appropriate after 60, most of it is flat out wrong. And that misinformation is just confusing. It's harmful. I'm Dr. Mohit Kara, professor of urology and expert in men's health for over 30 years. I've worked with thousands of men in their 60s, 70s, even 80s, and I can tell you, sexuality doesn't shut down with age. It evolves. Yet, here's the paradox. While society tells older men to quiet down about their desires, science is telling a completely different story. What if I told you that masturbation in later life ain't just safe, it might actually be one of the smartest, healthiest things you can do for your heart, your prostate, your brain, and even your immune system? In today's episode, I'm going to break down the research and real-world clinical insights to help you understand the truth about your body. No shame, no judgment, just clear, honest answers. And later, I'll also reveal the one hidden signal that could mean your solar habits are a sign of something deeper. This is about reclaiming your health, not apologizing for it. Let's get started. Before we get started, if you haven't subscribed yet, I encourage you to hit that button and turn on the bell so you never miss honest science-based health advice made specifically for men in their golden years. And if this topic matters to you, type 1 in the comments. If it doesn't, type 0. I read every response and it helps me create content that truly supports your health and your life. Let's begin with the foundation. Understanding how your body changes as we age and what that really means for your sexual health. Because before we can talk about whether masturbation is a thing, we need to be clear on what's normal, what's not, and why you're desiring something to be ashamed of. 1. The aging body. What really happens to your sexual health? When I first started practicing medicine, I thought the hardest part of my job would be diagnosing complex conditions or performing delicate procedures. But I quickly realized something else was even harder. Getting older men to talk honestly about what's happening with their bodies, especially here it comes to sex. I've had countless men in their 60s, 70s, and beyond sit across from me, visibly uncomfortable, struggling to ask one very human question: is what I'm going through normal? Let me tell you, yes, it is. As we age, one of the most predictable lessons in the male body is a gradual decline in testosterone. Starting around age 30, men lose about 1% of their testosterone each year. By the time you're at your 60s or 70s, that adds up. But testosterone isn't just about libido. It also affects your energy, your mood, your strength, and yes, your sexual performance. That's where a lot of men begin, Tory. Erections take longer, they are not as firm, it may take more time or more stimulation to reach orgasm, and the recovery period after sexual activity, that's longer, too. For some men, these changes feel like a personal failure, but I'm here to tell you what you're experiencing isn't failure, it's physiology. It's not broken, it's just different. What truly breaks my heart is how men suffer in silence. They think they're alone, they think something's wrong with them, they think they're less of a man because their body has changed. But let me reassure you, the desire for intimacy, for connection, for pleasure, those don't vanish with age. In fact, for many, those desires deepen. You just have to learn how to work with their changes, not against them. Your body may be aging, yes, but it is still capable, still responsive, still deserving of attention, care, and even pleasure. And the moment you start seeing your sexuality not as something you lost, but as something evolving, it's the moment you begin to reclaim it. Now that you understand what's happening going the inside, let's tackle one of the most persistent myths out there. Is sexual activity, especially masturbation, dangerous for your heart? The answer may surprise you. 2. Heart health. Debunking the danger myth. Over the years, one of the most common fears I've heard from my older male patients, good, honest men who want to stay healthy, is this: doctor, isn't sex too risky for my heart at my age? And many of them lump masturbation into that fear as well, as if any sexual activity cold suddenly triggers something dangerous. I get it. The idea of having a heart attack during sex is a scary one. We've all seen those headlines. Eamon in his 70s, dies in bed. The media loves those stories. But here's what decades and decades of cardiology research actually tells us. For most men in decent health, sexual activity is about as strenuous as climbing to flights of stairs. That's it if you can. Do that without chest pain, breathlessness, or dizziness. Your heart can handle sex, including In fact, regular sexual activity, solo or partnered, may actually protect your heart. I've seen this time and again, both in research and in my own patients. A landmark study published in the American Journal of Cardiology followed over 1,000 men. For 16 years, it found that those who had sex less than once a month had a 45% higher risk of developing heart disease than those who had sex twice a week or more. Why? Because orgasm is more than just a moment of pleasure. It's a full-body event. Your heart rate increases, your blood vessels dilate, and afterward your body releases calming hormones that help regulate blood pressure and lower stress. Masturbation, in particular, offers lesser cardiovascular benefits without added pressure or performance anxiety some older men feel during. It's a safe, self-paced, and natural way to keep your heart energetically and figuratively. But beyond blood flow and heartbeats, there's something deeply emotional about this. Many older men, after suffering heart scares or being diagnosed with, like hypertension or arrhythmia, give up on sex altogether. Not because they want to, but because they're afraid. And that fear creates isolation. But fear, when not rooted in fact, steals joy, connection, and confidence. You deserve more than that, so, if your heart can handle a brisk walk, chances are it can handle it. And once you know that, it opens the door to a bigger question. How does all of this connect to one of the most overlooked parts of a man's body, ages, the prostate? What I'm about to share next might completely change how you view self-care. Prostate health 3. Prostate health. Natural maintenance you didn't know you needed. If there's one topic older men don't bring up often enough, unless they absolutely have to, it's the prostate. And I understand why. It's a part of the body most of us never think about, until it starts causing problems. But here's what I want you to know. The prostate isn't just some small silent gland buried deep inside your pelvis. It plays a central role in your sexual and urinary health. And caring for it becomes even more important as you aged up. By the time most men hit their 60s or 70s, the prostate naturally begins to enlarge. We call this benign prostatitis hyperplasia, or BPH. It's not cancerous, but it can make life miserable. Weak stream, that frustrating feeling that you can't quite empty your bladder, and waking up 2 or 3 times a night just to use the bathroom, it wears you down. It affects your sleep, your mood, even your confidence. Now, here's the part that surprises many of my patients. Regular ejaculation, including through masturbation, can help support prostate health. Yes, you heard that right. When you ejaculate, you're just releasing semen. You're also clearing out built-up fluids in the prostate. That release improves circulation in the area and helps reduce inflammation, which may ease some of these symptoms associated with BPH. A study out of Harvard found that men who ejaculated at least 21 times per month had a significantly lower risk of developing prostate cancer compared to those who did so only a few times. While that number might seem high, the point is clear. Use it or lose it applies here in a very real, very physical way. The prostate was designed to be active. Letting it sit idle isn't doing you any favors, and I've seen it firsthand. Men who maintain a healthy sexual routine, including regular solo activity, often report better urinary flow, fewer symptoms, and a greater sense of control over their health. They feel more connected to their bodies and less like a passenger on a ride they can't steer. But beyond your prostate, there's something even more powerful happening during sexual activity. Something you can see, but you can definitely feel. It's what goes on inside your brain, and the impact it has might just surprise you. Let's take a closer look. For mental health, hormones, and the brain, there's something remarkable that happens in a man's brain during sexual. Something I wish more people understood, especially as we age. I've had patients in their 70s tell me, "Doc, it's not even about the sex anymore. It's about feeling normal, feeling like myself again, even if just for a little while." And you know what? That feeling is rooted in real, measurable brain chemistry. When you orgasm, whether through sex or masturbation, your brain releases a cascade of powerful neurochemicals. Dopamine floods your system, giving you a rush of pleasure and motivation. Oxytocin, often called the bond hormone, helps reduce anxiety and fosters a sense of calm and connection, even when you're alone. Endorphins is a physical discomfort, and prolactin helps our body relax and transition interest. It's not just emotional, it's biological. Your brain is built for this. As we age, these chemical benefits become even more essential. Older and more vulnerable to depression, loneliness, and sleep problems. I've had widowers tell me they felt disconnected from the world until they gathered themselves permission to feel pleasure. And what happened? They began sleeping better. They felt more stable, less irritable. They started reconnecting with themselves and eventually with others. There's even growing evidence that regular sexual activity may help preserve cognitive function. One study published in the Archives of Sexual Behavior found that older adults who remained sexually active performed better in memory tests. That's not a coincided brain. One that experiences pleasure, connection, and release is a healthier brain. And when you combine that with the emotional clarity and confidence that comes from honoring your body's needs, it becomes clear. Masturbation isn't just about, it's about mental resilience, you see. Sexual health is deeply intertwined with emotional well-being. When men deny themselves pleasure, they're often denying themselves peace. But when they allow space for intimacy, even solo, they often rediscover a part of themselves that was never gone, just buried under years of guilt or misinformation. And while all this might seem like more than enough reason to embrace this part of life, we're not done yet. Because what if I told you that regular sex could also strengthen your immune system in ways you never? Let's talk about that next. Immunity 5. Immunity, a natural boost. This might surprise you, but one of the most overlooked benefits of regular sexual activity, including masturbation, is its effect on the immune system. No, it sounds almost too good to be true. After all, we usually think of immune strength coming from things like diet, exercise, or vitamins. But pleasure, most people never make that connection, and yet, science is showing us it's very real. Back when I first read the research, I'll admit I raised an eyebrow. A study out of Wilkes University found that people who had sexual activity and saw twice a week had significantly higher levels of immunoglobulin A or IgA, which is a key antibody that plays a crucial role in fighting off infections. We're talking about a 30% increase in IgA levels. That's a meaningful boost, especially for older adults whose immune systems naturally become less efficient over time. Think about that for a second. Something as natural and accessible as self-pleasure, practiced regularly and without shame, might actually help your body defend itself against colds, viruses, and more serious illness. There's something powerful, almost poetic about that. In taking care of your emotional and sexual needs, you may also be strengthening your physical defenses. And this isn't just about antibodies. Regular sexual activity has been linked to lower levels of cortisol, the stress hormone, and when stress levels drop, your immune function typically improves. I've seen this play out in real life, too. Men who stay sexually active often report feeling more energized, less anxious, and even getting sick less frequently. There's a deeper message here, one I've shared with many of my patients. When you treat your pleasure as a legitimate part of your health, not something shameful or silly, you begin to care for yourself in a more complete way. It's not indulgence, it's maintenance. Just like eating well, or getting your steps in now. By this point, you might be wondering, if all of this is true, if masturbation is safe, natural, and even beneficial, why do so many men still feel ashamed or uncertain about it? Well, it's time we talk about the myths, the outdated, dangerous beliefs that have been holding men back for generations, and some of them may be things you've believed for most of your life. Let's clear them up once and for all. 6. Myth-busting. Correcting myth-busting, common fears and misconceptions. After all the science, the studies, and the real-world stories from my years in practice, one thing still frustrates me deeply: how many good men continue to suffer in silence because of myths been told all their lives, myths that make them feel ashamed of their bodies, doubtful of their instincts, or even afraid of something as natural as masturbation. These beliefs don't come from medicine, they come from misinformation, cultural stigma, and outdated thinking, and it's time we talk about them head-on. One of the most damaging myths is this idea that men become too old for sexual activity. I hear it all the time: doc, maybe I should just let it go. I'm 70 now. Isn't it time I moved on from fat? My answer is always the same. Moved on from what? From being human. From feeling pleasure. Age doesn't take away your right to connect with your body. It simply changes how that connection looks. Another myth is the belief that it's not normal, that older men don't masturbate or shouldn't, but the truth is, research shows that over 40% of men over 65 don't engage in regular masturbation. That's not weird, that's not broken, that's normal, and that number might even be here, If more men felt safe enough to admit it, then there's the fear that masturbation will somehow worsen medical conditions like diabetes, heart disease, or high blood pressure. But, for the vast majority of men, the opposite is true. Regular sexual activity is associated with lower stress, better sleep, healthier hormone balance, and improved cardiovascular function. Of course, if you have a serious condition, talk to your doctor. But don't assume pleasure is off limits. And finally, I often hear this: I should save my energy for more important things. But what could be more important than your mental clarity, emotional peace, and physical well-being? Masturbation isn't a waste of energy, it's a way of restoring it. So, if you've been carrying guilt, doubt, or hesitation about your sexuality as you age, I hope you are beginning to let that go, because the truth is freeing. And now that we've broken through the myths, it's time to bring everything together. In the final section, I'll give you the bottom line. Clear, direct, and from the heart. Let's finish strong. The bottom line. 7. The bottom line. Clear, direct, and from the heart. So, here we are after walking through science, the stories, and the truth that so many men have waited years, sometimes decades, to hear. If you've made it this far, I want to thank you not just for watching, but for showing up for yourself, because this conversation isn't really about sex, it's about health. It's about dignity, it's about reclaiming a part of yourself that you may have been taught tolerance. We've talked about how your body changed with age, how erections may feel different, how recovery takes longer, how desire evolves, but doesn't. We've broken down the myth that masturbation is dangerous for your heart, and instead revealed that it may protect it. We explored how regular sexual activity can support prostate health, sharpen your mind, boost your immune system, and lift your mood. And we tackled the myths, those quiet lies that make too many good men feel like they are doing something wrong, when they are simply being human. As a doctor, and more importantly, as a fellow man, let me say this clearly: you do not need permission to care for yourself. You do not need to feel shame for being alive in your body. Your sexuality is not a relic of your youth, it's a thread that ties into your